let's review the personality disorders. When you look at the definition of personality disorders, they're nothing more than pervasive, inflexible, and maladaptive patterns of behavior. So these are things that we do that probably annoy everybody else, but as far as we're concerned, we're okay, and it's everyone else who has the problem. So when you think about it in psychiatric terms, personality disorder patients tend to be ego dystonic, meaning they're okay with themselves, they're happy with the way they are. And personality disorders are going to be divided into clusters. And everybody in that cluster does have a lot of similarities. So you need to know the name of the cluster and who's in the cluster. So cluster A is the odd eccentric type. And everyone in there is a little bit strange. They're going to have some thought process problems. And of course, they tend to have problems with affect. And in that cluster, you find the paranoid, the schizoid, and the schizotypal. Cluster B is the dramatic emotional type, and as you can imagine, everyone in there tends to have problems with their mood. They can have some dissociative symptoms. They're preoccupied with rejection, and in that cluster you've got the borderline, number 1, the narcissistic, number 2, the histrionic, number 3, and the antisocial, number 4. And in the last cluster type, cluster C, is the anxious, fearful type, and everyone there tends to be on the anxious side, and they're very sensitive to criticism. And in that cluster, we have number 1, the avoidant, number 2, the obsessive-compulsive personality, and number 3, the dependent personality. So nobody knows what causes personality disorders. Are we born this way, or do we learn to become this way? Chances are it's going to be a little bit of both. So the risk factors could be innate temperamental difficulties, or it could be something that happens in our environment, or something that we learned from our parents and we watch them react to things, and that's how we become as well. Now, as far as some of the personality disorders, there are certain types of characteristics. For example, men tend to have more of the antisocial and the narcissistic personality disorders, whereas women tend to have more of the borderline and the histrionic personality disorders. We usually do not diagnose these disorders in children or in adolescents, but if we have to, we have to. The only one where we must wait until the age of 18 is the antisocial personality disorder. The reason being that anybody under the age of 18 will immediately be diagnosed with conduct disorder. And once you turn 18, then you will be the antisocial personality disorder. As far as the course of these disorders, it tends to be very chronic. And as you can imagine, that stressful situation will exacerbate your symptoms. As far as the paranoid, the schizoid, and the narcissistic, these people tend to do worse as they get older. As far as the antisocial and the borderlines, given that they're the most prone to violence or impulsive types, then these, of course, tend to do better as they get older. Individuals who have personality disorders tend to have problems with relationships, they tend to have problems with unhappiness, they tend to have problems in their work life, their home life, every other aspect of their life, as well as feelings of low self-esteem, and many of them, of course, could have mood disorder. And the treatment of choice for personality disorders will be individual psychotherapy. Pharmacotherapy can be used, but as far as your test is concerned, put individual psychotherapy as the number 1 answer. Now, the differential diagnoses is the mood disorders, of course, any kind of personality problems because of a mood disorder or even an adjustment disorder.